April is National Stress Awareness Month. During this time, healthcare professionals work tirelessly to increase public awareness about how stress can negatively affect both your mind and body. Fortunately, the Chickasaw Nation offers a number of helpful resources year-round to aid in stress management. So take the time to assess your own well-being, because your good health is essential to thrive.
Life has its ups and downs, but during especially hard times, it is often difficult to bounce back. The Psychosocial Unit provides access to trained psychologists to help Chickasaw citizens overcome challenging circumstances and regain their emotional well-being.
Psychologists are based more in the broader study of human behavior and cognition. So we're trained to assess people more in terms of their thinking, their emotions, their behaviors. I deal with the full range of mental health diagnoses like attention deficit disorder, learning disorders, autism, post-traumatic stress disorder, bipolar disorder, depression, anxiety.
Whether a long-term problem or temporary affliction, the Psychosocial Unit is equipped to manage all types of cases.
I also see people who are going through situational problems. They've had a major loss in their life, they've lost a loved one, or they've lost a job. Two people can go through the same experience and one person snaps back relatively well and the other person just can't seem to get past it and they need help.
To provide the highest level of care, the Psychosocial Unit schedules private one-on-one sessions between doctor and patient, taking time to deeply understand the issue before making a diagnosis.
We have the luxury, because of the way we schedule our patients, to sit down with them for a couple hours or more if necessary in one setting and get that entire history, have them answer all kinds of questions, test their memory, their learning style, their personality, if that's what's necessary.
The Psychosocial Unit's mandate doesn't end with a diagnosis and treatment plan. Rather, their comprehensive style of care includes developing support networks for recovering patients.
One of the core values of the Chickasaw Nation is taking care of each other, coming together as families or as a community to care for one another. We are all in this together, take care of each other, we look out for each other, we share each other's burdens and each other's successes.
Seeking mental health support can be overwhelming. The Psychosocial Unit provides a judgment-free zone in which Chickasaw citizens feel empowered to ask for help.
Stress is a normal, inescapable part of life. Whether it's managing daily trials and tribulations or dealing with the fallout from a traumatic event, there are many ways to improve the way you handle stress, and the nation wants to help.
The nation's comprehensive medical family therapist program offers unrivaled services to its citizens, with one of the best programs in the state. Therapists work with doctors, nurses, and other medical professionals right inside the Chickasaw Nation's medical facilities. A doctor may call a therapist in after seeing a patient, or the patient can ask to talk to someone.
This form handoff looks like the doctor saying something like, "You will be visiting with another member of our care team today, and they have a few things that they want to talk about with you." And so then the medical family therapist steps in and talks with the patient for a few minutes. And then most times the medical family therapist, upon leaving, will consult with the doctor and let them know what some of the things that they've talked about and maybe some of their recommendations for the patient's care.
The medical family therapists are trained to discuss a wide range of issues with patients, including anxiety, depression, grief, stress, and relationships, as well as treatment for their diagnoses. The therapists also talk to family members who may be struggling to understand their loved one's diagnosis.
But also the family may be dealing with some grief as well due to learning about the diagnosis, and maybe some things will change in their life when they go home. There's nothing like putting all of our heads together to be able to help a patient.
Medical family therapists work in many areas at the Chickasaw Nation Medical Center, including obstetrics, pediatrics, and the emergency room. They're also available to talk to the Chickasaw Nation medical facilities in Ardmore, Tishomingo, and Purcell.
Establishing a support group is important when facing life's difficulties. Whether you decide to join a support group or seek professional help, the nation has made a lifelong commitment to supporting your journey to a healthier you.
No one is immune to life's challenges. That's why the Chickasaw Nation offers assistance to struggling families through the Strong Family Development Office. Therapy is available for mental illness, drug or alcohol problems, and other issues that can negatively affect families.
Marital problems, premarital counseling, and then family problems that may involve children, blended family issues, things of that nature.
Others come without really knowing what they need help with.
It doesn't have to be major depression or a major anxiety disorder. It can be, well, I feel off. You know, I've been feeling off for a month or two.
The Strong Family Development Team says no one should be anxious about sitting down to have a conversation with them.
There's a certain kind of magic to therapy that I think you have to be in it to experience it.
Patients go through an assessment to determine how a therapist can serve them. They also help develop their own treatment goals, and then they work with the therapists to meet them. The therapists believe the process is empowering for clients.
They're a lot more likely to achieve those goals, and they're a lot more likely to put the work into achieving those goals.
On average, people attend 6 to 10 sessions with their counselor, but they can continue to visit as long as they want. Through the program, individuals have been changed, which benefits their families for years to come.
Their lives have been restored, marriages improved, children's behavior at school and in the home significantly improved. They've overcome addictions, they've restored relationships, they've gone back to work, helping build strong future generations of Chickasaws.
For more information on the many well-being resources available for Chickasaw citizens, please visit chickasaw.net.